October is Breast Cancer Awareness Month, and with me in studio is Dr. Eric Hungo. He is a general and breast surgeon, and he'll be walking us through breast cancer awareness, what you need to know. Many thanks for joining us, Dr. Eric. Let's begin with the importance of self-tests and self-checking, and what a woman or a man needs to check, and when, and how to go about it.
Okay, so self-breast examination or breast self-examination and breast awareness is very important because it means that the lady is helping us take care of them. So the things that we advise our patients is that you need to do this every month. You don't have to wait until you're 40 to start doing this. You can start even in your 20s. We recommend that you do it at least once a month. You do it. You can be very consistent. You can select a specific time during the month, or you can time it according to your cycle. So you can do it a few weeks before, a few weeks after, or a few days. So how we recommend you do it is that first you stand in front of the mirror, you take off your top, you take off your bra, you stand in front of the mirror, you check yourself for symmetry. Of course, one breast is usually bigger than the other one, but you want to check is one becoming significantly larger. You also want to check for any skin changes. By skin changes, you might look for something like redness. It might look like it's getting thickened. It might have some dimpling, like an orange peel appearance. Sometimes when you look and there's a lump, you can obviously see a distortion there, like a swelling. And then I know most ladies do the self-check when they go to the shower. So you can do that when you go to the shower, when you've soaped yourself. When you want to check your left breast, you use your right hand. You put one hand above your head, then you check. You just go systematically. So you're also checking now for the swelling, for any nipple changes. You want to press and see if there's any nipple discharge. And you must also check under the armpit. Sometimes you get some swollen lymph nodes there, and it's important to look for those ones as well.
Okay.
Yeah.
So if you happen to notice an abnormality or a lump or any of that dimpling or maybe discharge that you're talking about, what's the next step? So
once you feel, so the importance of doing the self-check is not because you will make the diagnosis. The importance is that you will know what's normal for you, because most times things will not change. But the reason why we say you time it according to your cycle is that during your cycle, the breast feels a little bit different, it gets a little bit bigger. So the importance of doing these monthly checks is that you know what's normal for you. So the minute you feel like something is strange, something is different, you go to the doctor. Then now the doctor will do what we call a triple assessment. He'll do a clinical breast, he or she will do a clinical breast examination, and then they will send you for imaging tests. So depending on your age, you'll either go for a mammogram or an ultrasound. Sometimes you find that one does not give adequate information, so you might need to get both. And then if something is spotted on the imaging, then you will recommend that you get a biopsy. Biopsy basically means you're getting a bit of tissue from the lump to take it for testing.
All right.
Yeah.
In terms of early detection, when we talk about screening and early detection, how important is this as we talk about breast cancer awareness? So
screening basically means that you're not unwell. It's done on the normal population, on a healthy population, and the purpose of that is to pick up early disease. So for breast cancer, the recommendation for screening is doing annual mammography starting from age 40 by our local national guidelines from the Ministry of Health. From age 40, it's because we noticed that we are getting younger and younger women getting breast cancer as opposed to Europe, to the Western world. So from age 40, we recommend that you do annual screening mammograms, and as you're doing that, you also get a clinical breast examination from a trained healthcare worker. So the importance of this is that it has actually been shown that when you pick up breast cancer early, it's a potentially curable disease. Yeah, okay. The prognosis improves.
And in terms of causes and risk factors, what are those?
So risk factors can be broadly classified into two groups. Can have the modifiable risk factors and the non-modifiable risk factors. So the non-modifiable ones are things we can't do much to change. So those are things like gender. So breast cancer obviously is more common in ladies. Men can also get breast cancer, but as a proportion of the population, that's 1%. Other things that you can change is ethnicity. It's been shown that African women are more predisposed to getting cancer. Family history. and genetics. That's another thing that you can't change. Those are the non-modifiable risk factors. The modifiable risk factors are things that you can do something about. So in terms of alcohol intake, smoking, lifestyle choices. So you need to eat healthy so that you don't get obese, because there's an association between obesity and getting breast cancer.
Right.
Yeah.
Treatment facilities here locally. We know that medical tourism has been on the rise, especially when we talk about cancer treatment. So in terms of facilities that are available, that have got cancer centers, what are we looking at locally? And in terms of costing, is this an affordable facility? Is it an affordable treatment option as regards treatment in this country?
So locally, treatment facilities, we can broadly, again, classify them into public sector, private sector. So for the public sector, at least now we are having more centers that have comprehensive cancer treatment centers. So of course, KNH is one that has been there for quite some time. Currently now we have KU, and actually I think today they are launching their comprehensive breast cancer clinic. Mm-hmm. And then in the counties, we have Coast General. I know they have an oncology unit with radiotherapy facilities. I think Meru also has. If I'm not wrong, maybe Garissa, but I'm not so sure about that. We'd have to confirm with the ministry.
Right.
And then, of course, we have the private facilities. Most of the private facilities, the bigger private facilities in Nairobi will have these facilities. Mm-hmm. In terms of cost, for the public facilities, as long as you have NHIF, I think you should be adequately covered. But in private sector, because treatment of breast cancer and cancer generally is a long journey. So for breast cancer, the journey takes 12 months, give or take a few months, right, because there are very many options. You have surgery, radiotherapy, chemotherapy, and then depending on some other tests, you could have targeted therapy and hormonal therapy. Mm-hmm. So in the long run, this can accumulate to quite some hefty amount.
Right, and Daktari, the fear of losing a breast for most women is real.
So the decision to get a mastectomy, things are changing now. Previously, most patients would get a mastectomy. Currently, a majority of patients will still get a mastectomy, but sometimes you'll find that that's because of patient preference. The other thing is that most of our patients locally present with what we call locally advanced disease, as opposed to patients whose cancer is picked up on screening, because on screening you'll pick up a disease that you can't feel. Right. So when you do your self-breast examination and a clinical examination, you don't see anything. But on imaging, you see microscopic disease. But unfortunately, most of our ladies come with larger tumors. Sometimes they even come with tumors that have ulcerated. So these ladies, you need to start with chemotherapy. And chemotherapy will help reduce the size of that tumor. But then it limits us in terms of surgical options. So we just have to do the mastectomy and remove the whole breast. But having done that, there are still options for reconstruction. We can do reconstruction either as an immediate option at that same sitting, but if it's locally advanced, you might find that for the most part we do what is called a delayed reconstruction. That's like a year after they finish their treatment. Mm-hmm. But in terms of if it's not that locally advanced, we can do what we call a breast conserving surgery, mm-hmm, where the lady gets to keep majority of her breast. We just remove the area that's affected, and depending on how much comes out, you can do a reconstruction with a tissue flap.
Mm-hmm. Is breast cancer curable?
It is potentially curable, but we need to catch it early. That's why we must always go for screening. You must be aware of any changes in your breast. That's your breast self-examination and self-awareness.
Right. Yeah. We've been talking to Dr. Eric Hungo. He is a general surgeon and breast surgeon. And of course, you can forward the rest of your questions to us right here on #FridayNight at Citizen TV Kenya at Lillian_Muli.